Public Health Madison and Dane County announced today that Dane County will move into phase number 1 of the Dane Forward plan. There's still a lot of questions surrounding all of this.
Janelle Heinrich, Director of Public Health Madison and Dane County, is with us this afternoon to answer a few of those questions. Janelle, welcome to Live at 4. Good to see you.
Thank you. Thanks for having me.
This is exciting news. It's big news. Busy day for you today, so we appreciate your time. Can you tell us what phase 1 will look like? What is allowed in Dane County under phase 1?
Sure. In phase 1, we're excited to be able to essentially open up most businesses at 25% capacity, and that's determined kind of in a variety of ways, pending the way your business is organized. It allows for mass gatherings to happen outside, and you can go to the restaurant again and get your hair cut.
How about gyms and fitness clubs?
25% capacity in that, with special precautions. What we're really wanting to support is that we've taken a risk-based approach to apply that across the types of things we like to do, the businesses in Dane County, to support a risk mitigation strategy throughout, so that we can put the appropriate things in place to support building confidence of everyone to be able to get back out and about more, while supporting businesses and understanding the things that they can do to be able to support their business and their customers.
What if you have a loved one in a living assisted facility or a nursing home? Will you be able to visit them now?
No, we're still really asking and supporting that really is limited unless it's for compassionate care to the greatest extent possible. There is high risk. We have vulnerable folks living in different places, and we want to support their ability to stay well.
Why was now the time to move into phase 1?
The data is looking really good. We have a bunch of greens on our dashboard and some yellows, which basically means that we have capacity within our healthcare system. We have low incidence, low daily case counts, and we think that we're able to rapidly respond should we see a little bump up.
Yeah, there has been a little bit of an increase in both the number of cases and in the number of tests, of course, and statewide today, the percentage of new positive cases went up slightly. So what has to happen to move into the next phase?
To move into the next phase, we need to keep on the path that we're staying with and not have any reds pop up. And so what that means is, we need to keep our daily case count low. We need to keep the overall positivity rate low, and we need to keep folks out of the hospital so that our healthcare settings won't be overwhelmed, and that we have the ability in public health to understand where people are when they are sick, who they're in contact with, and we can keep them contained. We can keep the virus contained from there.
If a number of those categories go into the red, can you get rid of phase 1? Can you go back to the way it was, or is this going forward?
Well, the goal is that we're all moving forward, that we're always moving forward. And but we have a 6-phase plan overall that it could indicate that we might have to go backwards, but we know what we had in the past that we would go back to, but that's not our goal. And that's the whole point of having a stepwise approach forward, is so that we can take careful steps and we open things up and we can see what that looks like from a disease transmission perspective and capacity and healthcare perspective, and not have to take that backward step.
Is there anything you can tell us about what this might mean for UW-Madison and the likelihood of having Badger football this fall? That's really the $6 million question that so many people are wondering about.
Yeah, well, I hope that we can get to phase 3 sooner rather than later. But by and large, not just from Public Health Madison, Dane County, but from the CDC and, other leading healthcare public health entities, the recommendation is that large gatherings are limited or, not happening at all. I don't think any of us want to think about a fall without Badger football. It's important to all of us in Wisconsin. But it does create a great risk of bringing a lot of folks close together while we still may be in a phase where we don't know enough about this virus to really keep the keep transmission contained.
So at this point, we don't know. All right, we have some questions from viewers, and we're going to get to those right after the break. Don't go anywhere.